This is the ZMAR Podcast. Elite Benefits of America helps small and mid-sized companies with their health insurance programs. And now, your host, Butch ZMAR.
Welcome back to the ZMAR Podcast. Today, I brought on a special guest, Ben Krambeck from ClaimDoc. Ben, tell us about yourself and a little bit of your background.
Thank you, Butch. Ben Krambeck. I'm born and raised in Iowa, and I've been in benefits business for almost 20 years. I started as a group rep for Sun Life Financial, selling stop loss and group life, short-term, long-term disability, and really fell in love with the benefits business, and specifically stop loss and medical reinsurance right away. My background being a group rep or a field underwriter really lends itself to getting into the next aspect of my career, which was we started, myself and a couple of guys started group stop loss captive businesses and started doing the group stop loss captive programming back in 2005 and 6, and then went full time with that in 2009, first quarter of 2009, putting together employer groups, putting together pools of 2,000 plus employees, and then allowing those employers to purchase their stop loss medical reinsurance as a collective, and thereby creating an opportunity for underwriting gain, which would then be redistributed back to those groups on a pro rata share basis. And we majored in that for several years. I still own that business, Benefit Captive Re. However, I just don't really do anything with it at this point. It was a client need and the reason why we created that company in the first place. It really led to the creation of ClaimDoc because we had one particular captive program that had over $6 million in stop loss, and we had over 5,000 employee lives and over 26 employer groups that were participating in that captive. And in the first quarter of 2012, really about 18 months, almost 2 years after the passage of the Affordable Care Act in March of 2010, we had 42 claims post PPO discount that were over $500,000 in that one captive program. And we had 17 captive programs, and we're seeing a huge trend in all of our particular programs that we were managing at that time in the increase in severity and acuteness of claims. So we were seeing a huge uptick in the number of large claims and the severity. So the actual numbers that were going up at an alarming rate, largely due to the Affordable Care Act's unlimited lifetime benefit maximum component. And in 2012, the annual maximums went up to $2 million for the annual benefit maximum. So it appeared that the hospitals had figured out exactly how to maximize their revenue, and it pertains to employer-sponsored benefit plans. And in that challenge or that crisis of the first quarter of 2012, ClaimDoc was born because we created a workflow process to mitigate those 42 claims. And throughout that year, we were able to keep that captive from having collateral call and a reinsurance hit. So we maintained solvency. But at the end of that year, I remember saying to my wife, I'm never taking risk again unless somebody is managing claims, because the no audit provisions of these PPO contracts and the outlier provisions are getting worse and worse. And I only see this going up. I don't see rates going down. So, and my wife, being the brains of the outfit, said, well, it looks like there's a business need there. Employer groups are going to need someone to mitigate and manage these claims. And I said, you know what, you're right. And we learned a lot through the 2012 experience. So in January of 2013, I started ClaimDoc. And luckily, we had several groups that we were already working with in our captive business. And I was able to take that idea to some of them and say, you saw what we were able to do here. What would you think of just tearing the PPO out entirely and doing what we've done by putting this language into the summary plan description and plan document and going for it. And we were very fortunate as a startup to have some groups that, were okay being the guinea pig. And ever since, we've been growing by leaps and bounds and And that's kind of the story.
Yeah, and it's an excellent story. And I guess to go a little bit more in the background of how we evolved to get to this point, just as the industry as a whole, is these fully insured carriers hide a lot of their costs and their line items, and we don't have control of looking at those claims. We don't have control whether somebody's overpaying for a claim or where the claims are at, or where we can actually reallocate resources to actually make it better. And so I think employers are just blindsided by some of these increases that come along because there's no way of controlling the cost. And you've probably been seeing that for years.
Absolutely.
And that's where I come, and I call it the purple unicorn of the industry, because they call these network PPO contracted discounts, but they originally marked these claims off of a charge master list that nobody really has access to. But a lot of times it seems like it's a made up number, and then they have this, this discount, and then the claim pool is paying the claim, and on a fully insured, the employer doesn't see it, the broker doesn't get access to it. And so we're going into all these claims or all these renewals blind, and we don't have access to information to actually look at all this stuff. So moving forward, these products have probably been in existence for a long time, not specifically what you guys are doing at ClaimDoc, but the self-insured and having disclosure of some of the claims that help allocate resources. But you guys took it from one step further, and I think with even groups that we've been working with and ClaimDoc experience that's been there, where these claims are getting reviewed, like you were saying, and medical claims could be, or most of the time, are overcharged. And how is anybody, even the employee that's filing the claim as a policyholder, even going to know? And then you guys obviously get in depth. So some of these claims that get through, you guys actually have an audit department. Can you talk a little bit about just a high level overview of how that audit department works, and just to give our listeners a little bit of feedback on how you guys are handling those claims?
Sure. We have coders and nurses that are in-house. All of our employees are in-house. We don't sub out any work. But we do line-by-line audit for all facility claims. And when I say facilities, I mean inpatient, outpatient, ambulatory surgical centers, radiology clinics, dialysis centers. We do a line-by-line audit for all facility claims, as well as all provider claims. And by providers, I mean specialists and general practitioners. So on the physician side, right, everything that's over $2,000 in billed charge. So we look at all of those things on a line-by-line basis and get human eyes on them. Now, our systems, our internal system called Novatech, which is a creation of ClaimDoc and our IT staff for the last 9 years, that helps and assists us, allows us to review a lot of claims per auditor per day. However, there is human eyes on every single claim, because the tactics, if you've been watching the Wall Street Journal, there's been a lot of activity in healthcare technology, in investment in healthcare technology, and these are businesses that are called claim clearinghouses. What the claim clearinghouses are doing are providing services to hospitals, where they go and they say, look, it's all about the reimbursements. We're going to boost your reimbursements by boosting your billed charges. And so our audit process is basically the counter move to that type of bundling and unbundling. What I mean by that is, today you go to a car, you buy a car off of a car lot, you have one price, and you drive the car off the lot. Unbundling would be, here's the price for the car, and then also if you want a bumper, here's a rear bumper, here's a rear view mirror, here's the seat, here's the steering wheel. They unpart everything, right? Like the reverse of Johnny Cash's song, build it one piece at a time. They deconstruct that claim one piece at a time and bill your health plan, your employer, for every single item. Plus, they may even bill it for the bundle as well, which we consider to be double billing. So there's those types of tactics, and our audit catches all of that, as well as third-party liability. So not talking about subrogation, but third-party liability, like, for example, if a facility goes in to do a knee replacement, and unfortunately they make some mistakes and hit a femoral artery and have to bring in a vascular surgical team, and maybe the member gets septicemia, they get an infection as a result of that error. We would not just say, oh, well, let's discount that bill and pay it. We look at all of that and say, no, I'm sorry, the hospital needs to write off under your surgical liability coverage on your property casualty carrier you need to write off your mistake here. Our client is not going to pay for your mistake on that. We'll pay for the knee replacement, but we're not going to pay for the septicemia, the hospital-acquired condition. We're not paying for the vascular surgical team to come in and provide, that service as a result of the mistake of your orthopedic surgeon, for example. So it's really getting into not only the individual bills, but then also what happened in rare instances.
Hey gang, ever wonder what it's like to be a small business owner? It's confusing, weird expenses coming out of nowhere, and when you throw in health insurance, forget it. Nobody understands how that works. If you own a business, big or small, it's one of the biggest expenses you have all year long. And yet, we all wait until open enrollment at the end of the year, and then we think to ourselves, next year I'll get a jump on it. And then it's another year of paying way too much. If you're a business owner, big or small, HR representative that wants to impress the boss, give Butch Zemar of Elite Benefits of America a call. Save yourself or your boss thousands or even tens of thousands of dollars a year. Reach out to Butch right now, 708-535-3006, or shoot him an email, butch@elitebenefits.net. And be sure to check out the Zemar podcast. Don't wait till the last minute. Put Butch Zemar to work for you now.
And now I pulled a couple case studies from the website, and I know I didn't prep you on it, and I'm not worried about the details of each one of the claims, but just to kind of give our audience a high-level overview. On one of the claims that I pulled, there was an inpatient hospital surgical services bill for $88,000, and you guys reviewed it, and there was some extra stuff that was put in there to allow change of a code, and then you guys requested, I think it was some medical records, and the hospital actually never responded, but what they end up doing is just changing the diagnostic code just because you called them out on it. And it actually, and in this scenario, the one that was given on the website, it dropped from 88,000 down to 28,000, giving the employee, the policy holder, and then obviously the claims pool, a savings of almost $60,000 on that same claim.
That's the norm.
Yeah. And we've been through it even on a smaller level. Sometimes you just have to call and from a provider perspective, just call and say, hey, can you explain a little bit more about this claim? And sometimes that just opens up the door and they're like, hey, this doesn't look right. And then, mistakes happen on a regular basis. Some are intentional, some are not. And a lot of these bigger claims, I think, probably are designed this way because they have to pay for, like you had mentioned, technology increases and their cost is going up. So they got to catch the money some other ways. Another example you had on your website was related to outpatient cancer treatment. And this one you guys have outlined from Texas, and the operating room was $36,000 plus some other providers that were there, and the total bill charges were $65,000 and some change. You guys were able to go in there and line item those things and brought the bill down to just under $4,000. And I think that's awesome. And the employer is obviously going to benefit from this on the renewal. And because there's less impact to the claim pool when it's set up properly. We haven't seen too much from my agency perspective, but that doesn't mean ours is the case study. But we have in our peer groups of our industry with the insurance industry, there's brokers out there that are doing this on a much higher level, and we're talking about thousands and thousands of employees, tens of thousands, and they're implementing some of these strategies and. They're actually the renewals are actually going backwards compared to where they were at, and so it's reversing it, and they're actually saving hundreds of thousands of dollars, if not more, and then it just keeps going backwards each year, regardless of what the claim experience is of the group. And obviously, there's other measures and resources you could put in, but besides the auditing, this is bridging a gap on something that's more of a newer term called reference-based pricing. There's a process for this, and in the beginning, there was actually some negativity around reference-based pricing, but because of ClaimDoc and some other high-class organizations, they were able to fine-tune the program to a certain degree to help streamline things so that there's not these excess bills. Can you walk us through, from your experience and your perspective, what reference-based pricing is, what's there for, and what's the purpose of it? Sure.
The concept of reference-based pricing is to get away from what you talked about earlier with regard to the charge master, this top-down discount off of a bogus discount off a completely made-up number scenario where you have no control, and looking at it and saying, okay, we want to make sure that our healthcare partners in our community are making a profit and or on everything that we do. However, let's look at things from a bottom-up cost basis plus a profit margin reference, or some entities that we compete with are out there using Medicare only and saying Medicare plus X percentage. We don't do it that way for a number of reasons. We don't have enough time to get into all of that on the podcast. But the point is to come from a geographic reference that is known and published, and then marking that up to a fair and reasonable reimbursement rate. That's the concept of reference-based pricing. When I started ClaimDoc, or in 2012, I had never heard the term, and it was very, very, very new concept of just even looking at bills and trying to audit them and reduce them. So the term really came after we got involved in this particular market segment. But I like to say, like Chick-fil-A, we didn't invent the concept of reference-based pricing. Like Chick-fil-A, they didn't invent the chicken sandwich, but they perfected it. Here at ClaimDoc, we didn't invent reference-based pricing. However, we are perfecting it. And in order to have a competitive and also long-term sustainable program, there's certain characteristics that have to be in place in order to take care of the member from a service level perspective. And we excel at that, where we do have several competitors who are falling down that regard. But, that's really where it's going. The future of it is really looking to partner with employers and facilities, hospital systems in their close quarters geography to source the right care to the right place from a quality of metric standpoint. So getting their quality metrics and sourcing the right care at the right facility for the right price. Contracting either on a bundled rate basis for specific types of services with this place or this facility. Maybe it's an ambulatory surgical center or outpatient facility for these items, and then having a more global, overarching, narrow network type of arrangement with one really high quality or high class facility in your area. That's kind of the building a home base and working together, the employers with a health system in a specific geography to work together to keep costs down, but also to keep that facility in business as well. So, we've been in court cases as co-fiduciary with an employer group. We provide legal defense in the event of a litigation scenario versus a member or a health plan. And we've been in litigation scenarios where we find out through the discovery process that the hospital elected to set their charge master at an arbitrary rate, 5%. They did a market study, did geographic market studies, and found that here's what all the other hospitals in their area are charging. We're going to charge 5% on everything. We're going to charge the 5%. We're going to charge the most of everyone in our geography, say a 50-mile radius, for example. That's pretty arbitrary. And I don't believe that that's sustainable for the long term for employers. It's a tax on employers that they didn't have an opportunity to refute or vote on even. So the blended or the future could be, rather than just taking what you're given, going out and being proactive and finding direct contracting opportunities which can get your employees the best care or the right care for the best price.
And that's a great background on it. And obviously, reference-based pricing, ClaimDoc are just line items of building the right plan together. And I know ClaimDoc works directly with TPAs and then obviously brokers. But if there was employers out there that wanted to seek more information about ClaimDoc or a little bit more about the background, is there other sources other than brokers? Can they go to your website?
Yes, thank you. It's www.claim-doc, and that's DOC, as in what's up doc.com. claim-doc.com is our website. And yes, we serve at the pleasure of the broker. We have no direct client relationships. So we are complete wholesale entity.
So definitely bring this up to the current broker or third-party administrator that we're working in. Obviously, ClaimDoc is having some success. I did notice, trying to do some homework for the podcast, that you guys moved to a new facility. You just had a ribbon cutting over there.
Yes, we did. We bought a building, a 33,000 square foot building in West Des Moines, Iowa. We moved our location there to house our expansive growth, and then to give us a future headquarters. So we've been growing rapidly for the last 8 years, and I don't see that trend slowing. So we're prepared for the future.
Great, and obviously this is a trend. It's moving up. A lot of brokers that were closed-minded before are opening their minds a lot more, and obviously employers are looking for these solutions to try to control the healthcare trend and keep their employees happy, getting access to great healthcare. And this has definitely been great, and I appreciate all that you're doing and ClaimDoc's doing for the broker community, and obviously indirectly down to the employee level of making sure that people aren't overpaying for claims and keeping the healthcare costs at a minimum.
Excellent. Thank you, Butch.